pre-exposure for at-risk people who may be swimmers, or if you are exposed, what should be done. And then we'll finish with Tess Gridley, who's going to speak about seal behavior and how you what you need to know if you are encountering a seal. And I think Tess will tell you about the organization that she works for, and she's been very, very involved right from the beginning in diagnosing this outbreak. So we will, of course, have lots of questions, so feel free to post them in the chat, and I think we'll have enough time at the end to answer them. So can the speakers put their videos on? Well, mine doesn't work, so there you go. What can I say? You'll manage without me. So I think let's start with Lesley. Over to you. So we've got some PowerPoints, but I think we'll make it quite informal and happy to answer any questions. So thanks very much. Lesley.
Thanks, Lucille. Yeah, I do have a PowerPoint. It's quite short. Hopefully I've pitched it right for the audience that's here tonight. If there's anything I've left out, we can always ask some questions. Okay, so this is where we're standing at the moment. I often get asked how many cases of seal rabies have we had, and as of today, there are 72 that are confirmed by laboratory testing in South Africa, and most of them are from the last year, but there have also been some from historical samples all the way back to 2022. As you can see, they span pretty much the entire coast of the Western Cape and the Northern Cape, which overlaps pretty neatly with the distribution of Cape fur seals along the coast of South Africa. So it's pretty fair to assume that wherever you see a Cape fur seal along the coast of South Africa, there is a chance that it could have rabies. How did the seals get rabies in the first place? I get asked this a lot as well. In Southern Africa on land, we have rabies cycles maintained in domestic dogs, in black-backed jackals, in bat-eared foxes, and in yellow mongooses in different parts of the country. In the Western Cape and the Northern Cape, it's mainly in bat-eared foxes, with the drier western half of the country. We don't have endemic dog rabies cycles in the Western and Northern Cape, thankfully. But when we looked at the Cape fur seal viruses and basically plotted them on a family tree, we saw that they're very closely related to each other. So they're all on the same branch of the tree. They have a common ancestor, which indicates that there was a single source of infection. And since then, the seals have been maintaining the outbreak by giving rabies to each other. So it is within the seal population and they're giving it to each other. It's not a case of every rabid seal has been infected by a land mammal. The seal rabies viruses were not closely related to rabies viruses from the Western and Eastern Cape. The closest relative found so far is rabies from a jackal in Namibia. We're not sure exactly where in Namibia, but this seems to be the most likely explanation for the start of the outbreak, is that a seal somewhere in Namibia was bitten by a rabid animal on land. The seals that have tested positive for rabies so far have shown a whole lot of different clinical presentations. I'm sure Tess will talk more about this later. Plenty of them were just found dead. Some of them were in the end stages of rabies. Rabies is a disease that affects the brain and the nerves. So in the end stages of the disease, the animal is almost completely paralyzed and they slip into a coma. So that seal second from the left, she couldn't move at all. She could just twitch, I think, one of her flippers a little bit. Then we also see tremors and repetitive movements. And then the classic sign of rabies, which you don't always see in rabid animals, is abnormal aggression. Some of the animals displaying abnormal aggression have been able to be caught or shot and tested, but quite a lot of them haven't, because if there's a seal in the sea being aggressive, people get out of the way into safety as quickly as possible, and then often the seal can't be found again. You can see the 1/3 from the left there is biting a rope. That is a classic sign of rabies, aggression towards inanimate objects. And the one on the furthest right is chasing a boat and trying to bite the boat. That is definitely abnormal behavior. Okay, a little bit more about rabies transmission. So if an animal is showing signs of rabies, it's acting strangely, it can definitely transmit rabies while it is showing those signs. It can also transmit rabies for a few days before it starts showing any signs. So even if it's behaving normally, if it's about to start showing signs of rabies, it can also transmit rabies. The time from when an animal is infected with rabies to the time it starts showing clinical signs can be quite long, or it can be quite short. It's extremely variable. It can be anything between a few days to a few months. Then for an animal to give rabies to you, you have to have direct contact with it. There's a lot of rabies virus in the nervous system, so in the brain and the nerves, and then it's shed a lot in the saliva. So most people who contract rabies, it's through a bite. They get the saliva on any broken skin, so obviously a bite basically injects the saliva under your skin. But it can also be saliva on any broken skin or mucous membrane, so like the inside of your mouth or the inside of your nose. And that's why people can also get rabies from being scratched, because claws are often contaminated with saliva. And then when they scratch you, that goes under your skin. You can also get rabies from getting contact with brain or any nervous tissue on broken skin or mucous membranes. So that's why we recommend nobody touches the carcass of an infected animal. You can theoretically also get it from eating an infected animal, though this has never been documented. Other exposures, rabies virus is very fragile. So when it's out in the environment, exposed to sun or seawater, or it dries out, it usually inactivates or kills the virus pretty quickly. So if somebody is worried about walking on the beach, or they've touched an animal and they don't have any broken skin and they wash their hands afterwards, that's usually not something to worry about. And then I just thought I'd mention, thankfully, we've had no human cases of rabies so far. What does this mean for the future? Well, as I said earlier, the seals are transmitting rabies to each other. It seems to be very well established in their population. So what we call in a situation like that is it's an endemic disease situation. The disease is not going to go away on its own. Whether we're going to see fewer cases or more cases in the future, we don't know yet. This is the first time that rabies has caused a big outbreak in a sea animal. So it's something that only time will tell, unfortunately. So what are we doing about it? There isn't a lot that we can do to protect the seals from infecting each other. The only thing you can do to protect animals is to vaccinate them, and that's not feasible when you have 2 million seals living offshore all along the coast of Namibia and South Africa. So the approach that we have to take is protection of victim species, and that includes any other species that could get rabies from a seal. Obviously, the number one is humans that we are trying to protect. So in a lot of places, conservation and coastal authorities are monitoring their seal colonies, and if they see an animal that looks like it has rabies, they try to remove it as quickly as possible before it can bite anyone. There's a lot of awareness going on, and really anything that can be done to prevent contact between seals and humans, like you see on the right there, should be done. We can individually vaccinate some strategic groups of animals. So I'm sure some of you have heard, for instance, that the seals at the Cork Bay Harbour are part of a vaccination trial. These seals have more contact with humans than the average seal. So by protecting them, we can hopefully prevent them from getting rabies, and therefore prevent anybody catching rabies from them. And then something that's really important that everybody can do and is required by law is to vaccinate dogs and cats against rabies, and to keep their vaccines up to date by revaccinating them every 1 to 3 years. This is really important, not only to protect the dogs and cats, but also to protect people, because most cases of human rabies come from dogs. Then our health colleagues are going to talk some more about pre-exposure prophylaxis and post-exposure prophylaxis. And then there are some local municipalities who are doing additional things, for instance, requiring dogs to be on leashes on the beach. which is just another way of preventing contact between dogs and seals. And then the last thing I wanted to say, if anybody sees a seal acting strangely or any animal that they suspect has rabies, it is actually a requirement of the law to report that immediately to your local state veterinarian. Here are the contact details of all the state vet offices in the Western Cape. If you do report a seal, then we have contact with all of the relevant people who can respond very quickly to that case. So please do let us know as soon as you can if you see any animal that you suspect has rabies. And here are my contact details if anybody wants to follow up with me. Thanks.
Thanks very much, Lesley. I think you've set the scene, and perhaps we'll keep some questions to the end. And I think we'll look more at seal behavior when we move on to Tess in the fourth presentation. So over to you, Janine, and what's happening on the human side.
Janine, you're muted.
Okay, perfect. I realized. Are you able to see the screen?
I think it's not in presentation mode.
Okay, let me put that in presentation mode quickly. Is that okay like that?
Yeah, perfect.
Okay, perfect. Thank you. So thank you so much, Lesley. I think that was a good introduction into what we're going to talk about, looking at the human side of this. And as Lesley said, what we are really concerned about from the Department of Health and Wellness is to make sure that, to try and ensure that no, there's no human cases of rabies. So just as a matter of interest, there were actually seal attacks going back, I think, till about 2021, where there were quite a large number of attacks. So the Department of Forestry, Fisheries and the Environment said that there was about 26 incidents of seal aggression in 2021. There were also some mass mortality of seals. The researchers and I think the vet services, they did some testing and they thought that domoic acid or toxic algae bloom was responsible for this aggression in the seals. And some of the samples, I think, tested negative for rabies in this period. So now, recently, so last year, we actually, our colleagues, Lesley and the vet colleagues, they informed us that there was a dog that was diagnosed with rabies. And this is following a seal bite. So we could not confirm this, but the owner said that these dogs, they do fight, they had an encounter with seals. So there's been investigation, but we couldn't really determine like the source of what's going on. Following this, we've also started to take note, and there were several reports of aggressive seal attacks. So seals were involved in fight with dogs. They were attacking surfers. If you go and you Google, and I think it was Dion Bing that did an interview with some of the surfers, then you can see how the seals were attacking the surfers. And then we started to go back and we thought, you know what, there is probably a big probability that the seals do have rabies. So we started to give post-exposure prophylaxis to people who were attacked by seals. So we were going back contacting people. And I think Prof. Lucille will also talk about the PEP and the PrEP in more detail in a bit. And then on the 7th of June 2024, that's when we had our first confirmation of a seal that tested positive for rabies. So I just wanted to show you, I'm going to show you some pictures as well so you can understand like the aggressiveness of the seals when they are attacking. So this is pictures from one of the surfers that were attacked during one of these incidents. So of course we were continuing with our response. And again, if you go and Google, so I think Lesley also spoke about this seal. So this is a seal, I think, in Mossel Bay that tested positive for rabies. So very aggressive. As Lesley also mentioned, fortunately, we do not have any suspected or confirmed human rabies cases in Western Cape at the moment, and we would like to keep it like that. But so far, we do have 109 recorded seal incidents. So this is from records by the research organization Sea Search, where they documented all of the seal attacks. And also from the Western Cape Department of Health, we have an animal bite surveillance that we are asking healthcare workers to complete. So the most recent attack was actually just over this weekend, and that was in the Robberg Plettenberg Bay area. And the oldest that we could find was in August 2023. That was on our list. And then a lot of these incidents actually do, a lot of these incidents are actually involving international visitors because it's people that come to visit us in Western Cape on the coastline and especially diving with seals.
Sorry,
Sorry,
can you mute? There's somebody who's not muted.
What did you say?
Please mute. Can that
Thank
person
you.
who's speaking please mute?
Perfect. Thank
Okay.
you, Prof. So together with Lesley, so Lesley and them, they're keeping track of all of the seals that test positive for rabies, and so we are also tracking all of the seal incidents that gets reported to us. So, but of course, this means that someone would have to go for medical treatment for us to know about it. And out of these ones, that out of the 100 plus that I presented, we do have 47 of these attacks that happened in the CapeTown metro area. And you can see, I also zoomed in a bit in that map so you can see really where all of the bites were. But it is across the whole province, so all the way from Langebaan in the west coast to Plettenberg Bay in Garden Route. And as I mentioned, we do see a lot of attacks here in Plettenberg Bay because that's where they are still doing some seal diving next to a seal colony. But Lesley mentioned as well, we do have seals all along the coast, and where we have aggressive seals, of course, there we will have some seal incidents. So just quickly to give you some feedback. So feedback from some of the victims that we spoke to, they're saying that these seals are quite aggressive. If you've seen seals before this or one that is not rabbit, then normally what they would do, they're very playful. They call them the dogs of the sea. So they're very playful. They will nip a bit and then they'll leave, and they'll nip a bit and then they'll leave. But these ones, they just keep attacking. They are very aggressive, very vicious. They can follow a person. That seal that attacked the surfers that I spoke about, I think he bit about 5 or 6 surfers in one morning, where he started at the one place and he just kept attacking people all throughout. And sometimes they grab on, they don't want to let go. So it can be quite traumatic as well. So what we've been doing, we've been working with a lot of the partners to do some risk reduction and mitigation. So, and especially for people and their pets that uses coastal areas. So I think Lesley also mentioned that rabid dogs, the canine rabies, it's really a big risk. So we are asking people to please vaccinate all of your pets. And then if dogs are being taken to the beach, that these dogs should be leashed as well so they can stay away from the seals. We are asking so the municipalities to put up posters as well so everyone know about the risk of the rabies. And then if there are any events like a big swimming event, I think we had the Ironman in Mossel Bay, or any other big events, we work very closely with those organizers to ensure that we have a plan in place to deal with aggressive seals. Now, for some people, we do recommend pre-exposure prophylaxis. I think Prof. Lucille will also go into that. That is if they have a continual risk for rabies. So if they're continuously being exposed, then you can get the rabies vaccine to prevent you from getting rabies. So after, if you do get into an attack by a seal, then you only need a rabies vaccine and not the immunoglobulin. But Prof. Lucille will go into more detail in that. And then what is very important for us is the awareness, and it's to stay away from seals. If you do see a seal, don't go up to them. We don't want people kissing them, feeding them. think some of the pictures that Lesley showed, a lot of people are still engaging and interacting with the seals, which is not what we want. We do want people to keep a safe distance from the seals. Now, post-exposure prophylaxis, that's the rabies immunoglobulin and the rabies vaccine, is available at some of the designated hospitals or facilities. So I'm going to show you. So this is the public hospitals where the rabies immunoglobulin is kept. Not all of the hospitals, public and private, do have stock of the immunoglobulin. So if you do encounter, an aggressive seal and there's an attack, then your healthcare provider and the hospital can reach out to the Western Cape Department of Health and these hospitals to try and arrange for RIG to be given to that patient. And I think that's everything from my side. Thanks, Prof. Thanks all.
Thanks very much, Janine. So let's move on. Please put your questions into the chat. I'm sure there'll be lots to discuss. And maybe you can show my slides. Thanks, Janine. Okay, presentation mode needed. Okay, I think that's good. So as you can see from this group, even presenting tonight, we use a One Health approach to rabies, and it means that there's a combined a group responding to rabies, and it's vets, it's researchers, it's environmentalists, and it's obviously human health people. And I think for the seal rabies, it's been quite extraordinary who is involved in this One Health approach. So I think what is important is that rabies disease is always fatal. There is no treatment. There have been one survivor in the States after bat-induced rabies, but for essential purposes, it is not treatable. And the child on the left died shortly after that photograph. It causes a fatal encephalitis. But it is preventable, and that is mostly, I think the most important intervention is animal vaccination. And as Lesley mentioned, most of the cases in this country are dog rabies, and that's the important source for humans. But animal vaccination, as far as seals goes, is really quite a challenge. So preventing it in humans is about avoiding contact, but also about giving what we call pre-exposure prevention to those who may have a risk and an ongoing risk, or post-exposure prophylaxis, which means after the event. And that sometimes is not easy because accessing the biologicals can be a problem. So it's one of the neglected tropical diseases, and there's an aim to eliminate human rabies, but from dogs by 2030. On the right, you see, I think, wonderful interaction from the Northern Cape about addressing dog rabies. And World Rabies Days in September every year, and it's really aimed to try and improve awareness of this disease. Next one. So I think Lesley covered this. You can't get rabies by just being in the same water as a rabid animal. You need a break in the skin. The virus is in the saliva. The saliva can be from the mouth, or it can be on the, I don't know about flippers, but certainly the paws of cats and dogs. And you need a break in the skin, a scratch or a bite or a direct lick of mucous membranes. It won't go through intact skin. And I think there's still some doubt about eating meat of a rabid animal. It's not in the blood of the animal, but that's not an issue here with seal rabies. Next one. And you can see sometimes the bite is not huge. So what happens when all these breaks in the skin are quite different, but they're all what we would call category 3, and we'll come back to that. So what happens when the virus is introduced? It will be introduced from the saliva of the biting animal. There will be multiplication of the virus in the muscle near the bite. And at some stage, and we don't know what that period is, it will enter the peripheral nerve, and then the virus will work its way to the brain. Now, during that period, and that period can be a minimum of 7 days, and it's 7 days if it's a bite on the face, which is closest to the brain, or it can be longer. And the incubation period, so the time of the bite to the development of the disease, can be up to a year. We've seen cases that have been bitten 2 years ago. There was even one of 5 years, but on average, about 12 to 15 weeks. And during that time, there are no symptoms and there are no tests that you can do to say that that encounter with that animal resulted in virus transmission. So it's a very anxious period for these patients. And you need to intervene right at the beginning when the virus is entered from the bite, and you need to neutralize it or remove it physically. So it's actually both of those to stop it going into the nerve. And the sooner you do that, the better. We are not sure, what that period is. It may be hours, it may be some days, but there's no way of telling. Once the virus reaches the brain, symptoms develop, and you can do some diagnostic tests before the patient dies, but they're not that good. There are good post-mortem, and you hear the word post-mortem. That is the gold standard, examining the brain to see if that patient had rabies, but that's too late. So you want to intervene right at the beginning, and if you do the interventions properly, you can have a very good outcome. They're very rare failures. The other way of doing it is to give the vaccine before, so that you've got good antibodies when that patient is bitten, and that will neutralize the virus. So there's 2 ways of presenting. Next one, please. So let's have a look a little bit more detail. And here you see some patients with rabies. All of these patients died. You see some hydrophobia, see the hallucinations, you see that strange look. There are painful spasms, and they're all, 100% fatality. But PEP, post-exposure prophylaxis, works in almost every case if given properly. Next one. Okay, so what do we do? The first thing is to do wound cleaning. And that is absolutely critical for all wounds, but particularly important for a potential rabies exposure. You don't know what that animal's got. And if you do it properly, you do it vigorously, and you do it quickly, you can physically remove the virus from that bite site. Obviously, on its own, it may not be 100% effective, but it's something that you can do, particularly with seal bites, because you're in the water. So the water, the seawater, I think plays an important role. Soap and water, if nothing else is available, and it's vigorous cleaning. And then 70% alcohol and iodine, if it's available, are really effective. What you mustn't do is use some of these newfangled fancy wound cleaners like peroxide. That's an old one, but there are a whole lot of new ones. It's just water, soap and water, alcohol, iodine to vigorously clean that wound. And it's easy to do when the person's in the sea. Then they need a tetanus toxoid. I don't think we've ever had any studies on tetanus risks from seals, but it's an opportunity to ensure people are vaccinated. And then there is a particular bacteria that you can get from seal bites. It's called seal finger, although it's a lot more than seal finger these days. And the antibiotic that is effective is doxycycline. So remember that this needs to be included for seal bites. And you need to do a risk assessment. Not every animal is rabid. And, seals can be quite friendly. They nibble. If you push your foot out, they will nibble you. But not every animal encounter is a rabies risk. And I think Tess will talk a little bit more about that. The decision about prevention using rabies prevention must be made on the risks of that incident. There are no blood tests that you can do on the person who's bitten to show that the virus is being transmitted. There is no antibody test that you can do, and you shouldn't wait for results in the animal. There are some delays. You may never get the result because communication may be a problem. So there has to be what's called a risk assessment made, and this is any animal bite, to kind of make a decision. That bite on the top left was in fact a dog bite in the Western Cape. It was a known dog in the area, but it used to wander freely and it was known to bite people. So when you see this, you think, oh my goodness. But this, there was no rabies incident. There was no rabies risk here. And this patient just needed wound care, tetanus, maybe antibiotics. There was no rabies risk. So it's not the size, not every bite poses a rabies risk, but we'll speak about seal bites in particular. And then for somebody who's bitten, attacked by, one of the seals that's been well described, we would institute post-exposure rabies prophylaxis. And that consists of rabies immunoglobulin, which is ready-made rabies antibodies infiltrated directly into the wound, and it will act immediately to neutralize the virus. Sorry, can you mute? Okay. And this is sometimes the limiting factor. It's not always readily available. Certainly, if you go to a pharmacy for post-exposure prevention for rabies, they're not able to give it and they need to refer you, and that may not happen. And then it's followed by a course of rabies vaccine. And the vaccine takes 8 to 10 days to work for antibodies to develop. And that's why the rabies immunoglobulin is so important. If this animal, is behaving in a way that suggests rabies and there's a break in the skin. Now, contrary to other injuries of the skin, we like to limit suturing. This is not the time for beautiful plastic surgery. Every time you put a needle in, you may potentially spread virus if it is there. So, sutures are only put in, if there's bleeding or bits of skin or muscle are hanging out. Sometimes you have to go to theatre to clean it up. And if you do put any suturing in, you shouldn't use local anesthetic. Again, it's a needle that potentially spreads the virus. And also the local anesthetic may dilute the rabies immunoglobulin. So sorry, grit your teeth. If it's a child, sometimes you have to do an anesthetic or a bite on the face, ear or scalp of a child. You have to take them to theatre. Next one, Janine. So let's look just very briefly at the risk of rabies transmission. I'll leave it to Lesley and Tess to speak about the animal species and the behavior. I think some of it's already described. Why were you bitten? I think that's a very important question. If you attack the seal or you trample on a dog's tail, they'll bite you. That is normal behavior. If an animal looks sick or dead, we can talk a little bit about that. That's a bit worrying. And last is the break in the skin. So people see a big wound like we did in that dog and go, oh my goodness, that's a rabid animal. But actually it's in conjunction with the animal species that's bitten the person and the health of that animal and why it bit. So this is a seal talk, but we get a lot of calls about baboons biting tourists at Cape Point. Well, that's what they do. They're quite grumpy and they don't like the tourists. They are not rabid. We get a lot of calls about dussies in the Cape Gardens. People go and feed them and they get bitten. I mean, they're not rabid. That's to be expected. And we don't get it from sharks. We don't get it from birds. We don't get it from reptiles. So, I think it's important to look at the species, and we don't get it from little rodents. If they were bitten by some sort of rabid animal, they'd probably die quite quickly. So I think that's important to consider. Next one. And we can come back to this because I think very important for deciding on, is there a risk from that seal? So there are 2 vaccines. They are both highly effective. They go through many, many safety checks. And that accounts for, I guess, some of the reasons why they're so expensive. 1 amp you're looking at, depending on whether it's private or public, you're looking at about 400 Rand. The post-exposure prophylaxis is free in the public sector. If you go privately, you will need to pay for post-exposure, although you may be able to claim it back, but it is free. And the 2 vaccines are interchangeable. VeraRab is what we mostly use, but currently there is a shortage. So ChiroRab would be a very good alternative. And if you start with the one and you have to use the other, it's fine. They're different sizes, which causes a bit of confusion, but 1 amp of VeraRab, 0.5 ml, is equivalent to 1 amp of ChiroRab. The only difference with ChiroRab is it's made in eggs. So if you're egg allergic, you shouldn't get it. But they're very safe. They're highly effective if given properly and in time, and they have very few side effects. And I think we've reached a stage where we have excellent vaccines. I think, 30 years ago, perhaps that was not the case. In terms of the schedule, for post-exposure prophylaxis, so this is somebody who was never vaccinated against rabies previously, it's given intramuscularly. It's given into the deltoid. There are 4 doses recommended. Never give it into the buttocks because they're fat and you will not have an immune response. The vaccine will stay there. If it's a child, it's the anterolateral thigh. The day 0 dose should be the day of the incident. And then there's a second dose on day 3, a third dose on day 7, and the fourth dose, anytime between 14 and 21 or even 28. So there is a prescribed schedule. One should try and stick to it as much as possible. If you come on day 8 and you didn't come on day 7, just continue. And the sooner you get it, the better. And if you do come late, still get it. What is too late, we really don't know. So that's the vaccine. Next one. And then there's the rabies immune globulin. There are 2 kinds. One is made in humans and it's in short supply, and one is imported. It's made in horses. It comes from India. Both are excellent products. They're quite pricey if you have to pay for it in private. Again, it's available free in the public sector, but this is the product that's often in short supply. And if you're out in a rural area, you're bitten by a dog, you may just get vaccine, but you really need rabies immune globulin. Preformed antibodies works immediately when infiltrated properly into the wounds. So the technique is important. You can see the small needle. Not everybody is good at the technique. You have to infiltrate every single wound. And in some of the seal bites, the victims have multiple wounds. If you don't have enough, because there is a maximum dose, you have to dilute it. You don't have to use the maximum dose. Sometimes 1 amp is enough if you've got a small wound. Wounds on the face, and children are often bitten, this is mainly by dogs, on the scalp, the eyelid, the ear, the mouth, the lips, the tongue. You have to attend to those. You can't go, oh goodness, I can't give it into the eyelid. You have to take them to theatre, sedate them, and give it. This is life-saving. So look for all the wounds. High-risk wounds are those on the head and face, and also on the tips of the fingers, because these are very innervated areas. We don't know what to do about, dogs that where the saliva gets into your eyes or into your nose. We just wash them out very well. You will have an occasion where there is no rig. I think the Western Cape is managing it very well. Start the vaccine and get hold of the rig as soon as possible. And the local authorities can help with that. Somebody comes, it's delay, and we had patients who were retrospectively treated 6 months, a year. We still gave them post-exposure treatment. We don't know how effective it is. We do what we can. The equine one very rarely has an allergic reaction, so needs to be given in a place where these can be managed. I think in thousands of doses used. We've had 4, and all the patients actually did very well. So it's only what can go into the wound. And we're trying to train as many healthcare workers as possible. I think the vets are well informed. Rabies is their bread and butter, and they often do quite a lot of advisories for the human side. But, doctors are not taught about rabies at medical school. So, you may encounter one who's unaware. We've done a lot of training in the Western Cape. So hopefully that should not happen. But it certainly happens elsewhere outside of the Western Cape. Next one. So this is a seal victim from Mossel Bay. He had 31 bite wounds. He went to theatre. They cleaned up the wounds, and hopefully they gave rabies immune globulin into every one of those wounds. They probably had to dilute it, but that's not uncommon when one is attacked by one of these rabid seals or rabid other animals. Next one. So this is in fact a researcher who went on a university ship to sailing to Marion Island, and they did some a dissection of seals, and she was asked to go at the last minute, so she wasn't pre-vaccinated. They opened the brain, and she cut herself on the finger. So it's a very small wound. And this call came through at night. Now what? And in fact, we made the decision that the ship should return. They went to Cuba, however would you want to say it, Port Elizabeth, and she got rabies immune globulin and vaccine. And in fact, the seal came with her. It was dead and frozen and whatever, but it was rabid. So I think we did the right call there. Next one, but she should have been pre-vaccinated and it wouldn't have happened. So just to use this opportunity to show you that it's not only big bites where there's a risk of rabies. All these animals were rabid. And the one in the middle at the bottom was a rabid cat. There was a shy aardwolf that doesn't normally bite people. That was a rabid jackal. But there's small bites. And some of these patients did not get the right post-exposure prophylaxis immediately, but we could try to correct that. The child on the bottom right was bitten on the face by a dog, Eastern Cape, did not get rabies immune globulin, I think got one vaccine. And this is a picture when he presented with neurological signs and in fact died of rabies. So yeah, it's not the size, it's the behavior of the animal and the circumstances. Next one. I think we're almost done. Okay, so cats are a bit of a problem. I don't think we want to dwell on that. This is a child who was bitten by the neighbor's cat, scratched, but there's a break in the skin in East London. Next one. Didn't get the right post-exposure initially, but yes. Any delays, try and avoid them. Still need to get post-exposure prophylaxis. I think we've spoken about the suturing, try and avoid that. If you couldn't come on Monday and that's your appointment and you came on Tuesday, just continue. No rig available, we're going to have to make a plan. And those who are pre-vaccinated, there's an advantage. They don't need rig. They've got good response to the vaccination that was given as preventative vaccination, and all they need are boosters. So that is what we're aiming for in people who are at risk by being seawater swimmers or divers or still, I don't know, practitioners or researchers. That's what we really want to do. They just need boosters. Next one. So what about pre-exposure? So I think all of you should strongly consider being pre-vaccinated. While the risks of encountering a rabbit seal are not high, you don't know when it's going to happen, and you don't always know what the delays are for you to get post-exposure prophylaxis. And you may encounter someone who's a medical person who's not used to it, or they've run out of rig. So I think you should strongly consider rabies pre-exposure prophylaxis. We certainly do it for all our vets and animal health technicians. I think many of you will fall into the recreational risk. I certainly advise it for people traveling in Africa, because if they are bitten by this unknown dog, well, they're not going to get post-exposure prophylaxis because there isn't any available. And people living in remote areas where there are, rabid mongoose and other animals, they just can't reach healthcare facilities. It's very easy. You can either get 1 amp intramuscularly on day 0 and day 7, or you can take a friend and you can share a vial, which will cut the cost because this is not funded by the state. You can share a vial and you can give 2 sites intradermal. So that's 0.1 ml in each deltoid, and then repeat that on day 7. And then if you are bitten, you don't need reg, big advantage. You just need boosters, day 0 and day 3. And if you were vaccinated in the previous 3 months, you don't need anything. And then for vets who are continually at risk for rabies, we do routine boosters every 2 to 3 years. But really, if you were vaccinated even 10, 15 years ago, and you now encounter a rabbit seal, all we'll do is boost you. It's a wonderful vaccine, very easily boosterable, and you will get a lovely antibody response and be protected. So they're really excellent vaccines. Next one. We've moved from intramuscular and allowed intradermal. It saves vaccine, it saves costs. We're only allowing intradermal at the moment for pre-exposure because it's very well controlled, but the rest of the world actually use it for after the event. You just need someone who can manage it, and find a friend. You can save at least 50% of costs. And if you're using the ChiroRab, 4 of you can go and you can save a lot of money. I think there's one last slide, Janine. So we do have a rabies helpline. So this is really for health professionals, where somebody from the NICD, it's always a doctor, can advise. So it's not generally open to the public. I think we would be overwhelmed. But if you go to a medical facility and they're not sure, you can use this. But we'll always try to help you. We will not ignore you. And there are guidelines. Don't go to the internet and look at rabies pictures. They will freak you out, especially if you've been bitten. But these are very helpful guidelines, WHO and also local. Thanks very much. So I'm done, and I'm going to pass on to Tess. And Tess will also tell you a little bit about Search and what they do, and then speak a little bit more about, so how do you know the seal is rabid? What is the risk assessment, and what has been the experience been? Thanks, Tess. Over to you. Please put your questions in the chat, and we'll have some time at the end.
I'm trying to share my screen. Let me know if it's working or not. Otherwise, I'm hoping Lucille can do it. Janine can do it. Can you see my screen or not?
Yes, thank you.
Yeah.
Okay, okay, great. So I'm just going to pull up my slides. Just give me a second. Okay. All right. So hopefully you guys can see this fully. If by now, please let me know. Can someone just confirm whether you can see this?
Perfect.
Okay, perfect. Yeah. So this is a PDF form. So for that reason, I'm going to save the videos to the end because I think that's going to be easier. So there are some videos within the presentation, but I think we'll play them at the end, and then that will also lead into the discussion time as well. So my name is Tess Gridley. I'm the co-director of an NGO which is based in Muizenberg in CapeTown called Search. And I have to say, Lucille, somebody is just a little bit afraid of needles. The previous presentation is quite full on, and it's just a reminder that we really are dealing with something that is very serious, and we all have our part to play to prevent being exposed to rabies. So thank you for that presentation. Okay, doke. So what I'm going to do is I'm going to talk to you a little bit about seal behavior, and I'm also going to explain and hopefully convey our experiences with working with seals at the colonies, and also from talking with people who've been bitten by seals who either fit the case definition for rabies or were subsequently identified to have had rabies through post-mortem examination and testing. Okie doke. So Cape fur seals in general are a highly gregarious mammal species. So they are actually considered one of, if not the most gregarious mammal that we have, and particularly in areas such as Cape Cross in northern Namibia, we have hundreds of thousands of individuals in the colony at any one time. As you can see in this imagery as well, the colonies are incredibly densely packed, and Cape fur seals are very social animals. These colonies are incredibly dynamic. There's social interactions going on all the time between the individuals of different ages and sexes. So for those of you who are sort of new to seals and maybe don't know much about their biology, I'm just going to provide a quick overview because it is important to the conversation. So seals give birth to, or the female seals give birth to pups around November and December time, and it's a synchronous breeding cycle. So that means that in any one year, the females will give birth around about the same time, and then those pups of that cohort will be together at the colonies for several months before becoming more independent. And for those seals that are either weak or perhaps born a little bit early, then there is a very high mortality in year one. And so we expect to see that around September, October time in particular, we start seeing seals that are either born early in the season or perhaps the previous year's pups who actually come up to the up onto the coastline, and some of those are quite weak and will unfortunately die. So we do see these annual peaks in strandings of seals and also of seal mortality, and particularly between September and October, and then also November and December. The death is really part of seal life, and for that reason, some of the earlier investigations into seals coming up on the shoreline may have not overlooked, but not necessarily investigated in too much depth the health of seals, because we know it is part of their life cycle. The females, once they give birth, actually come into estrus within about 6 days or so, and are actually mated with again. So basically, the females, once they reach adulthood, are pretty much pregnant year round. We have almost 2 million Cape fur seals spread between the south of sorry, it's really weird not seeing yourself or anybody else when you're giving a presentation. So I'm not used to doing this, so I'm
so we're all here, Tess, and we're listening. Yeah.
Okay, it's just incredibly very, very strange thing to be sitting in a room talking to myself. So if I sound a little bit hesitant, that's why, because you have actually no social cues whatsoever. Anyways, moving on. So we have around 2 million Cape fur seals, and because we have so many of them, they are not considered a conservation concern as such. So they are one of the species that is considered TOPS protected. So they are within the threatened and protected species list, which means, for example, that you can't harm them, you need to protect them and so on. But they're not endangered. The numbers of seals that we have is plentiful. And in some ways, studying their biology is important as an indicator species because there are so many of them. So if you do see changes in their health status or mass mortalities, then that can indicate something else going on in the environment. So we've talked a bit about them being a highly social and gregarious species. And in general, as researchers, when we go to the colonies, our biggest fear is not of being bitten by a seal. before rabies has become a thing in any case. But previously our biggest concern was of scaring the seals away, so of inadvertently flushing the seals, because if you scare one or two accidentally, perhaps you raise a pole in the sky. We do a lot of acoustics work. They have very poor eyesight on land. They have a good sense of smell but not great eyesight, and so they see this pole in the air and they just basically put a sort of a general rule that if something is higher than them, it's bigger than them, and therefore they should move away. And so if you have one or two animals moving, because they're socially gregarious, you get a contagion effect, and actually most of them will flush. And so that's our biggest concern as researchers working at colonies, is actually animals being scared off the rocks or fleeing into the sea. If you are lucky and you are calm and stay low and you're working at a colony, you will see very curious animals. And in the most part, if you're quiet and you approach upwind, then you can actually get quite close to the animals without being worried about affecting their behavior or them coming towards you. The seals themselves undergo a lot of interactions throughout the day with one another, and a lot of those are mediated by both acoustic cues and also gestural communications. So things like open mouth, with also a growl, with de-escalation of aggressive interactions through a series of these bark vocalizations. And so although it can, from the initial observations, look like there's a lot of aggression going on between the seals within a colony, and particularly during breeding time when you have large males there. In fact, it does follow set social rules, and in the most part, it doesn't lead to excessive injury for the animals involved. Of course, there can be exceptions to that, but in the most part, these vocal and gestural cues help to de-escalate. The mothers and pups have a very strong social bond. I mentioned that the pups are born November, December time, and again, the tactile communication as well as smell and acoustic communication, very important there. And in fact, some of the work that we've done has shown that the identification of mother and pup and recognition of mother and pup through vocal behavior is actually one of the fastest established recognition systems in mammalian biology. So they can recognize each other very quickly after birth, within 6 hours or so, and this actually facilitates reunions and finding each other again when separated in these busy colonies. So there's a lot more going on at the colonies than we maybe give them credit for. I'm showing these beautiful pictures of very cute and cuddly Cape fur seals because we do get animals that are vulnerable coming along the shoreline, particularly November, December time. And you can see here, this is what we call a black pup or a newborn pup. They're about 4 kilos when they're born. They don't have a particularly thick blubber layer when they're born, and they're not particularly water resistant. So they're quite vulnerable. And if they do get washed off the rocks and so on, and they come up along the beaches, they are often called in to rescue or rehab facilities, and at these times it is a time when members of the public do have exposure to these small animals. So the height of aggression that we see in Cape fur seals is really during the breeding time, and the males come up to the colonies, the large males, they start to establish their territories. It's not a large territory. It's very much about protecting access to females. And so any male will have around 20 to 40 females that they will be fighting over effectively, and they'll be protecting their harem and ensuring that they have those mating opportunities with the females in the harem. So we also know from the acoustics work that the males can recognize each other with their vocalizations, and that in fact that recognition probably again helps to de-escalate the excesses of aggression. I just want to point to here, there is a bite mark on this individual here. So, you do see animals that bite each other to the point of drawing blood, but it isn't that regular. Okay, they're generalist feeders. So our Cape fur seals tend to eat pelagic fish, but they'll also often be seen at the surface feeding on, say, octopus. And when they do that, they thrash their head around to break up the octopus. And that's important because some of the behavior that we're seeing in animals with rabies is very similar to this, where they're thrashing their head around, but they're doing it with inanimate objects. So in one case, you have an animal that's very, in one case, you might see an animal that's doing something quite natural, where they're breaking up food. In another case, if you're seeing that with, say, a plastic bag, then I would be more concerned, because that's more indicative of the animal suffering from rabies. And they're very far moving. And again, this comes into important when we're talking about rabies, because that's it's not necessarily the case that you have resident animals that will always be in the same location. They'll move far distances to go foraging, so hundreds of kilometers, and they can move long distances along the coastline. And in fact, animals that were relocated from Hout Bay up to Cleanseer due to concerns about their weight, actually moved back within a week or so. So they can move vast distances over very short time frames, and this obviously has important issues when it comes to transmission of rabies. Okay, so they're cognitively complex animals. There's a lot going on. They're long-lived, they're far-ranging, gregarious and very social. And these social interactions normally conform to life history expectations and hierarchies by age and sex. And they have gestural and acoustic communication rules which facilitate de-escalation of excessive aggression. So there's some rules and norms in their society. And I'm just going to move on from this one. We've already talked about the increase in aggressive interaction, so I'm not going to go over that in too much detail, but just to say that in one of the most high-profile cases where we had fishermen who had thought that they had been attacked by a leopard seal, one of the reasons that they had thought that was because of the behavior of the seal, because it showed a pursuit attack in a way that when unfamiliar with seeing Cape fur seals do. It was very much in the sort of behavioural repertoire of what a leopard seal would do if they were healthy and in Antarctica, but leopard seals in Cape Town don't tend to be that healthy. And so actually, when we scratched the surface a bit more, it turned out that it was most likely one of the first really aggressive Cape fur seals that we came across around the coast of Cape Town. Okay, these videos we'll show later on. And we've also been through some of the bites. Just to say that the behavioural description here is one of the first sort of descriptions that came up when we started asking people about their experience with the seals. And I think it really describes rabies pretty well in terms of what the animal did. So it's unprovoked. The seal came out of the water and up to the beach where it attacked a tent. Then it attacked a shovel, it charged at people, it attacked equipment and hoses, and en route back to the sea, it attacked kelp. It lay on rocks, snorting from time to time, and then it returned to sea a few hours later. It swam awkwardly with a rolling motion. And why I think that description is really perfect is that it covers all of these different components. And I think talking to people who are sort of water users, it's really important to note that you might come across a seal at any point within that that time frame in which it may be exhibiting signs of clinical rabies, and it might not just be the hyperaggression that you see, but it might be the sickness towards the end of their disease, and it could be anywhere in between. So don't just look out for aggression, but look out for changes in behaviour. What we found with animals that are rabies positive is that they often do come up with injuries, so jaws that are broken, bite marks on them, and we think this is because they are going and fighting excessively at the colonies, and in fact we've got lots of behavioural observations which show that to be the case. And we've also seen some really nasty, sorry, this is pretty nasty imagery, but nasty facial wounds on animals which have transpired to be rabies negative. So again, we think that these are the victims of animals with rabies at the colonies. There's a 3-minute video or so that I won't play now, but it shows the different components of rabies that we've observed in animals that we've watched, and this animal in particular we watched for about an hour and a half, and it shows that the animal was both neurological, but then also aggressive towards the smaller pups at the colony, and then also was lethargic and disorientated. So I think this is called stargazing, when they're looking up at the sky like this and sort of not able to really focus on anything in particular. But what is troubling is that a lot of the behaviours are going on at the colonies, and we can't easily surveil those areas. Currently, it's not easy to fly a drone over the colonies. There's fears of disturbing animals and so on. So actually surveillance is problematic, particularly when you're working with animals that are on offshore colonies, which is out of the realms of sort of passing by and just doing a couple of hours of observation. And one of the biggest issues with this is that when you do go and watch, you're only going to see sort of the peripheral areas. You're not necessarily going to see the whole colony in its full entirety, and also just sort of keeping your eyes on set individuals can be quite difficult. Having said that, when we have gone to colonies recently, we have identified on each visit 1 or 2 or 3 animals that are, in our opinion, fitting the case definition for rabies. So it seems to be passing on quite readily at the colonies. So just to show you what that might look like, on this grab here, you can see that there's an animal, there's 2 animals interacting in the image on the left side. This is a female and a male, which is against what we would normally expect in terms of social dynamics. And she kept coming in and sort of lunging at the male multiple times. And he was a bit surprised, to be honest, about what was going on. And the same on this image, which is Seal Island in False Bay, and you can see in the middle there's a small yearling, and you can see this big circle around that animal where there's a big space where there's no other seals sort of in that region. And in fact, when other animals did come into that area, then the seal was hyper aggressive and it would attack and lunge for those seals. And it wasn't just the seals of the same sort of age and social cohort, but it was actually also going for larger animals, adults, and so on. And so that's one of the indicators that we're really queuing in on, is when the hyperaggression is directed in a way that is against what you would expect in normal seal social hierarchies. I'm going to go through all of that and just, yeah, I'm gonna wrap it up there. But in general, what we are experiencing in terms of their behaviour, I can quickly show you in some short videos. Let's go out, and if I can, I'll try and talk over them in a way that might help. Now, I know a lot of people have already seen the video in which Debbie Hendricks was attacked on the Fishhook Beach. And one of the things that I think is important to note here is that Debbie was widely criticised for being too close to the animal. But in fact, if you look at this video, there was really nothing she could have done. And many people have been that close to seals before and would never have expected that reaction from the seals. So what we see here is a very abnormal aggression from the seal. And in fact, Debbie had been taking that photo because she had been watching the seal and well, for two reasons. One, it was a beautiful morning, and so she was taking a photograph, but she was also had watched the seal and thought it was acting unusually as well. Another example here that we're seeing is when the seals are biting inanimate objects and thrashing them around, and this sort of left to right thrashing of the head, when it's really extreme, I kind of say that it's like the animal's trying to thrash rabies out of its brain, but it's basically a similar behavior that you would see when they're predating on larger prey items at the surface of the water. But when we're seeing it in this context with inanimate objects, then that's one of the key signals that the animal might be suffering from rabies. And I think you guys have all seen the very hyper-aggressive attacks. And in general, this hyperaggression is extreme. We've seen animals now that have been still coming towards people, even though the people are, making loud noises. They're trying to scare the animal away. They've got brooms. They're doing all the things you would normally do if you wanted an animal to move away from you. And those animals with rabies are still coming towards and really sort of intent on making contact with people. Having said that, though, it looks like there can be some triggers. So there have been incidents as well where the animal has appeared to be very calm, just on the surface of the water, looks to be absolutely behaving normally, and then gets triggered by, for example, a loud noise or a splash in the water, and then that hyper-aggressive behavior is exhibited. So that's also something to be cautious of. It's the unpredictability, which is quite concerning. I'm going to leave it there, I think, because I've talked quite a lot and quite quickly. And as a social human, I don't really enjoy talking to myself in an office room. I find it very strange.
We're all here, Tess, and I think you've really illustrated it very well. Yeah. So thanks very much. I think we'll I think we've covered the topics, and maybe we could have some questions and answers. I think that was excellent. There are some Q&As in the chat. Some have been answered, but if anybody would like to raise their hand and ask a specific question, please do so. I think for me, for this group, it is key that you really highly consider pre-exposure vaccination. No one who's been pre-vaccinated has ever developed rabies if they've been exposed. And, while the incidents are quite rare, they do occur, and you can see they're pretty tough. And it does obviate that need for post-exposure prophylaxis with rabies immune globulin, which is both difficult, not easy to access. There are errors. And I think, this is a fatal disease, and I think it's worth putting in the effort, and certainly the financial means to pre-vaccinate yourselves. You've got ongoing risks. I think it's very reasonable. Okay, so let's take some specific questions. Maybe the speakers could just look at the chat and see if there are any that they would like to highlight. I can only see half the chat, and apologies for the wrong number for my very own helpline. I'm not sure how that happened, but thanks for pointing it out. Okay, just put up your hand, open up, show us your face, and ask some specific questions. Anyone?
Hi, thank you very much.
Yeah.
Dominique. It's Dominique de Hartman. Where do you recommend we go for the pre-exposure vaccination?
So it is at your own expense. You can access vaccine at a pharmacy, and that might be cheaper. Take a friend. Don't know that all the nurses there can do intradermal, so you won't save. Some of the doctors can do it, some of the travel clinics can do it. But certainly Dis-Chem, I know, has got rabies vaccine, and you can go there for pre-exposure. 2 doses, day 0 and day 7, 1 amp. Remember, it's not into the buttocks, because somebody asked about if you put it in the buttocks, why is it a problem? Well, it just stays there. You know, it stays on the fat and doesn't lead to an immune response.
Thank you.
Anyone else? Leila, see your hand up? No, you're on mute. You're on mute, Leila.
Sorry, I did such a good job of being on mute. What are the side effects? Like, what can we expect to happen after you take the vaccine?
You
Like,
might
can we
have
swim the next day?
absolutely. You might have a little
Okay.
bit of pain, like from any
Yeah.
vaccine,
Yeah.
but there are no side effects. Just remember the
Okay.
one, if you can't use ChiraRab if you are egg allergic. But
Yeah.
otherwise, a very safe vaccine. It's killed virus. There are some minute quantities of antibiotics. They're unusual antibiotics, so just, you know, ask about allergies. But otherwise, really no side effects. We've had people who've been bitten and then get the immunoglobulin and vaccine, and they get anxious and they get, you know, they feel unwell. But I think it's the incident and the fears around the incident that are the problem. So no, you
Okay.
can go swimming.
Okay.
You will be fine. In the arm, not the buttocks.
Okay. Thanks. Thanks.
Anyone else? So Lesley, are there any questions there that you've picked up on? I see
Lucille,
hands
I've
up.
already typed some answers, but I just wanted to say maybe you should mention to everybody that rabies vaccine is also perfectly safe for all ages, and if you're
Oh, yes.
pregnant
So,
or breastfeeding, you can also get it.
So there are no contraindications to vaccine or rabies immune globulin. Can be given and should be given in pregnancy if the person has been exposed. If it's a young baby, it's the same. The only time that it doesn't work that well is if somebody is very immune compromised. And generally, those would not be people who are swimming. So advanced HIV, the vaccine doesn't work very well. But for the other, it's really there are excellent vaccines. So there are no contraindications. I saw Lala, Dan, do you want to unmute?
Stephen? Yes, thanks. Thanks for a very, very informative presentations. Really appreciate it. Is it possible to get these presentations somewhere? Are they on a web or something one can download them?
I have recorded it, and I'll have to figure out where to put it because I'm not sure myself.
Yeah, the audio is less useful than the presentations because the audio is a long thing to listen through.
No,
but
if it's recorded,
and
sorry, if it's recorded, it records the slides as well.
You got lots of battery though.
Okay. So there are guidelines on the NICD website about pre and post exposure and the doses and the schedules. So www.nicd.ac.za, that is correct. So you can have a look at those. Tess, you wanted to say something? And then we'll have Bronwyn. Tess, you're on mute. Tess, I can see you and your hands up twice. Okay, let's go to Bronwyn first. Bronwyn McDonald.
Hi, okay, it's Stephen McDonald. I'm one of the Mossel Bay victims in the presentations. The question I have is the vaccine. How many years can one expect to have protection once? Well, I had the RIG and the vaccine.
Yeah, so it's very long lasting. But if you have been previously vaccinated and you're now looking more than 3 months, so you're looking at 5, months or years, you need boosters. But the boosters will work very well, even 10, 15, 20 years after your initial primary vaccination course. You will need, but you need to boost.
So the battery contains leaks and coastline. Yeah.
Sorry, I think we have some other opinions. So very, very boosterable years after the primary administration. Really, it's wonderful. They're wonderful vaccines. And you don't need reg if you've been previously vaccinated. In fact, you shouldn't get it because it will reduce the boosterability of the vaccine. It will dampen it down.
Right, thank you.
Tess?
Hi, yeah,
Your
sorry.
hand is...
I just meant to say that some of the videos that I showed there and other ones that we've taken of animals that have subsequently been positive, we've put up onto it. We've got a CSearch YouTube channel. So they are there if you want to have a look at some of the behavioral characteristics that we've been seeing. It's not a presentation as such, but it might help.
Okay. Janine, are there any questions you've picked up in the chat that you think we should be answering?
Thanks, Prof. So no, I think maybe they're just asking if there's a link or a document that can easily be shared with people who were not able to make the talk. But I also did share the Western Cape circular link, if that is helpful, just to create awareness as well.
Okay, thanks very much. So I see Lesley has added, the vaccines are VeraRab and ChyraRab. They're both excellent vaccines. VeraRab is in slightly short supply at the moment, but there will be new supplies coming in May, and ChyraRab can be used as well. Both excellent vaccines.
Just to jump in, Lucille.
Yeah, Bronwyn. Yeah. Tess, okay.
Sorry. It's important. Obviously, the vaccination is very important, but it shouldn't also be underestimated that the actual physical impact of being bitten is substantial as well. So, as you saw in some of the videos, but also from what we know of those people who've been bitten, it's, you know, it can be multiple places and it can be a very dangerous situation to be in. So absolutely the vaccination component to prevent exposure to rabies, but because these rabid animals are, you know, incredibly strong. So a male Cape fur seal can get up to 250 kgs, a female considerably smaller, but still around the same size and weight as a human, and even the pups as well. So just, you know, just a word of caution there that even if you're vaccinated, that's not going to protect you from the physical components and injury that can be quite substantial. We're very cautious about that, even though we're vaccinated.
Yeah, absolutely. You can get fractures, you can get all manner of physical injuries. So it's not just the rabies risk. The other part is the psychological effect. And people who've been bitten, even if they've received post-exposure prophylaxis, have a really difficult time. They go to the websites and they catch rabies from the websites, and the next day they're in your office saying, I have rabies. Understandably, it's a very, very difficult period. Lesley?
Sorry, Lucille, may I just interrupt? I need to go. So if there are any questions for me, maybe somebody can just shout them out or send me an email.
Okay. Yeah, thanks very much. Declan, anything you want?
Tess, you said that there was a YouTube channel where you've uploaded them. What was the name of the YouTube channel again? I heard you say Seafish, but I couldn't find it.
You muted, Tess. I don't know that she seems to be frozen. Yeah, there she is. Tess?
Declan, it's C-Search. I think Chris also just shared a link.
Okay, there it is. Right. Bronwyn, your hand is still up. Is it an old hand, new one?
Oh, sorry about that. Thank you so much. It was very interesting.
Okay, any other comments? Anybody want to raise a last question? Chris. Chris, over to you.
Yeah. Hi, guys. So I was the freediver that was attacked. Well, my client was attacked, but the seal attacked me first at Windmill Beach. And if we have any freedivers or divers on this meeting, I think what struck me the most was the seal went for after anything that moved. So what we did, we got on, we swam with our backs down and facing the seal so that it would attack our fins and anything that moved rather than us. And you'd rather be bitten on the foot than the face and the arms. So if there was ever any advice, that would be it. If you do encounter a seal, try swim backwards, trying to see where the seal is, and have your fins as the point of attack rather than your face and your arms.
Yeah. Good advice, Chris. Thank you for that.
Yeah. Cool. Thanks, guys. Really informative.
Thanks very much. Please feel free to contact any of us and be safe. Thanks very much.
Thank you.
Thanks so much, Lucille.
Bye.
Thanks,
Thanks a
everyone.
lot.
Thanks so
Thank
much,
you.
Professor and ladies, for just organising this evening, just from my side. And thanks to everyone for attending. I'll put something out on our ATB channels through SwimCapeTown very soon. Have a great evening. And thanks very much, Pam. Cheers.
Pleasure.
Thanks.
Bye.
Thanks all. Bye.